Hello everyone, I am Dr. Sirajul Akfazi. I welcome you in my YouTube channel. Today in this video, we are going to learn about triglycerides estimations. So let us start with the basic questions. The question is, what is the triglyceride level test? You know, the triglyceride level test helps to determine the amount of triglycerides in your blood. Amount of triglyceride in your blood. Triglycerides are type of a fat found in the blood. The test helps determine your risk of developing heart disease. The test is also referred to as triglycerol test. So, what are triglycerides? Triglycerides are a type of lipid and are the body storage form for calories that it does not use right away. These triglycerides circulate in the blood to provide energy for your muscles to work. After you eat, extra triglyceride can be found in the blood. If you eat more calories than your body needs, your triglyceride level may be high. Triglycerides are carried through your blood by very low density lipoprotein, VLDLs. VLDL is a type of lipoprotein like low density lipoprotein LDL and high density lipoprotein HDL. VLDL measurement can be helpful information when you and your doctor talk about option for reducing your triglyceride level. So, why is the test ordered? This test will help you determine your risk of developing heart disease. My friend, it helps to estimate the level of LDL cholesterol in your blood. It can also determine if you have inflammation in your pancreas. In addition, this test can determine if you are at the risk of developing atherosclerosis, which increase your risk of having a heart attack or a stroke. So when do you need to be tested? It is recommended that you should have a lipid profile done every 5 years as a part of your regular medical exam. The lipid profile tests your cholesterol, HDL, LDL and triglyceride level. If you are being treated for high triglyceride level, this test is carried out more frequently in order to allow your healthcare provider to monitor how well the treatment is working. If you are diabetic, it is important to monitor your triglyceride level regularly since triglycerides will increase when blood sugar is not properly maintained. Screening for children is recommended if they may be at an increased risk of developing heart disease. This includes children that have a family history of heart disease, diabetes, high blood pressure, or overweight. My friend, high-risk children should be tested first between 2 or 10 years of age. Children under 2 years are too young to be tested. Now, what do the results mean? The following are the basic categories of results for triglyceride level in milligram per deciliter. In milligram mg deciliter. Deciliter means dl. So normal fasting 150 milligram per deciliter. borderline high 150 to 119 milligrams, 199 milligrams per deciliter, high 200 to 499 milligram per deciliter, very high 500 milligram per deciliter. So, hypertriglyceridemia is the medical term for elevated triglyceride in the blood. Hyper. Fasting level can vary normally day to day. Triglycerides vary dramatically when you eat meal and can increase 5 to 10 times higher than fasting level. When fasting triglyceride level are above 1000 milligram per deciliter, there is a risk of developing pancreatitis. Immediate treatment to lower triglycerides should be started as soon as possible. My friend, if triglyceride level are high, your cholesterol may also be high, and this condition is known as hyperlipidemia. Now, friends, interpret your results. How you interpret it? There are many reasons why your triglyceride level may be high. Some of them are due to lifestyle habits that increase triglyceride level. These include smoking, inactivity, being overweight or obese, increased alcohol consumptions, eating a diet low in protein and high in carbohydrates. So, there are also medical conditions that can cause high triglyceride level, include cirrhosis in the liver, diabetes, especially if it is not well controlled, genetic factors, hyperlipidemia, hypothyroidism, nephrotic syndrome or kidney disease, and pancreatitis. Now friends, why low triglyceride level may be due to? The reasons for the low triglyceride level may be due to low fats diet, hyperthyroidism, malabsorption syndrome, and malnutrition. So how can I control my triglyceride level? Studies have shown that carbohydrates play an important role in controlling triglyceride level. Diets high in carbohydrate, especially sugar, can increase triglyceride. Exercise has also been proven to lower triglyceride and increase HDL cholesterol. Even if you do not lose weight, exercise can be beneficial to controlling your triglyceride level. So, American Heart Association recommends changes in lifestyle habit to help treat high triglyceride level. The changes include reduce the saturated fat, trans fatted cholesterol content of your diet, reduce your intake of alcohol, eat fruits, vegetables, non-fat or low-fat dairy product most often, get at least 30 minutes of moderate intensity physical activity on a 5 or more days each week. So my friends, what is the method of estimation of triglycerides? The triglycerides are determined after enzymatic hydrolysis with lipases. Indicator is quinoamines formed from the hydrogen peroxide, 4-amino antipyrines and 4-chlorophenols under the catalytic influence of peroxidase. You can see here, triglycerides lipases give glycerol plus fatty acid. Glycerol plus ATP gives glycerol 3-phosphate plus ADP. Glycerol 3-phosphate plus O2, it gives dihydroxy acetone phosphate and hydrogen peroxide, and then 4-amino antipyrine react with hydrogen peroxide, it gives quinone means HCl and water plus 4 chlorophenols. So my friends, pipetting scheme, please use only the human triglyceride standard provided with the test kits of especially available. You can see, and then people calculating the level of triglyceride with the help of this data. So I hope this video will be helpful to you for knowing what is the meaning of triglycerides, why you are more concerned about the level of triglyceride. So if you like this video, then subscribe my channel, and thanks for watching.